Hello, everyone. Good evening, and welcome once again to the Diamondlady show. So tonight I've got with me two wonderful people, and the topic is going to be all about childhood cancer. So I've got with me the Lions Club, and I have also got with me our pediatrician, which is in the name of Dr. Seriam. You have met her here live before. Before I go ahead and give them the chance to introduce themselves, I am going to try and go live on Instagram and then go live on YouTube as well, as promised, so that everybody can get the information. If you're watching us live today, we will suggest that you create a watch party on your Facebook. If you're on Facebook, create a watch party so others can also benefit from this information we're going to share with you tonight. We may have a bit of technical issues and technical problems tonight, but then we are going to try our best and make this a success. So without talking too much, I am going to give the doctor the chance to introduce herself for the sake of those who don't know who Dr. Seriam is. Could you please introduce yourself and what you do and about your page as well? Seriam, I think you've muted yourself.
I have. I'm sorry about that. Hi, everyone. Good to see you again. My name is Sarah Mwodwi. I'm a pediatrician. I work at Kolebu Teaching Hospital. I like to say it's the biggest hospital in Ghana. It is, actually. And I'm also the founder and chief executive of Baby Child & Co. Baby Child & Co. is it's an organization that is into child health. So we blog, we do school health, we do public speaking on child health. School health, you can follow us on YouTube. You can find us on Facebook. You can find us at www.babychildandco.com as well. I'm happy to be here.
We are happy to have you here with us tonight. It looks like our member from the Lions Club is having a bit of technical issues because we needed him to talk more about what Lion Club is all about and what they are doing. So maybe we'll just get on with the program, and then if he's able to join us later, he's going to tell us all about Lions Club, because tonight is mainly about Lions Club and what they are doing in collaboration for the childhood cancer and what their activities is all about. So as we wait for him to join us, probably we must as well go ahead. What do you think, Dr. Serial?
I think so.
Yes.
We just go ahead, yeah.
Okay, so cancer is something that is a form of sickness that is claiming a lot of lives in adults and in children. Well, I've got that lion, Oscar here. Let's see, maybe he's working better now.
Yes,
hi, Lion Oscar. It's
Hello,
much better now.
Sure.
All right. Before we go ahead and then I toss the question back and forth, let's welcome once again Lion Oscar, and he is going to tell us more about the Lions Club. Could you please introduce yourself and tell us what this is all about, please?
Okay, thank you, Diamondlady. Once again, my name is Lion Oscar Onai. I'm the charter president of Accra Harmony Lions Clubs, one of the clubs that is jointly hosting or undertaking this activity on childhood cancer.
Okay. So, Lions Club, I heard you've got lots of different branches in Ghana.
Exactly.
Okay. So, what's... You wanted to say something? I'll give you the chance.
Okay. In fact, I wanted to say that we have over 47,000 So 47,000 Lions clubs in over 200 countries worldwide.
Okay. Wow. Could you explain a bit more about the Lions Club, what their main motive is and all that?
Okay, so the Lions clubs, as the name sounds, is an association of a number of Lions clubs, as I said, in over 200 countries.
Mhm.
The Lions Clubs International was founded by Melvin Jones. Its headquarters is a global leader in a community of 5 main global causes. That's diabetes, hunger, vision, environment, and childhood cancer. So basically, this is what the Lions Club does. And we have a thing we say in the Lions Club International. We say that wherever there is a need, there is a lion.
Okay. All right. So with this program coming on
Can you hear me?
tonight, yes, we can hear you. With this program coming on tonight is in collaboration with you and then with Dr. Seriam, who is the CEO of Baby, Child and Co. So, and you guys are organizing an activity, isn't it?
Yes, so this activity is jointly being undertaken by Accra Harmony Lions Club, Accra Ebony Lions Clubs, and Baby Child and Co. And we are glad that you are hosting us for this activity. It is our hope that through this medium, we will be able to create awareness on the fact that childhood cancer is curable, with emphasis on early detection.
Okay, all right, okay. So, would you give us more insight into this activity? Is it something that people can just come and test their children, or something of that sort, which is happening within Ghana, or what is it going? Where is it happening? Is it happening worldwide?
Okay, so the Lions Club International has a calendar of activities that should be undertaken by clubs in each of the months of the year.
Okay.
For September and February, Lions Clubs International prescribes that we undertake activities on childhood cancer awareness. So basically, what Lions Clubs do in the months of September and February is to look for avenues to create awareness of the fact that though cancer can be deadly, childhood cancer in particular is curable. A lot of people do not know that childhood cancer is curable because of the myth that cancer in itself is not curable. However, or thankfully, childhood cancer is curable. However, you need to have detected it earlier. And so
Right.
when we it's our hope that when we educate the public on the fact that they need to look out for certain signs that shows that a child may have cancer, and as such go to a health facility to get tested. So we do not actually conduct or run any tests for people who have signs of or may have shown one or two signs of cancer, but then we just create the awareness for them to know that these are the signs to look out for. And when you see such
Okay.
signs, do not sit at home. Go to the nearest health facility to get tested.
All right. I will definitely come back to you later. It looks like there were certain points you were mentioning that is actually meant for the doctor to give us. So I will come back to you, Seriam. He has given us a lot of pointers already, and I'll
Yeah.
definitely come back to you, the professional, to give us this information. So, what is childhood cancer? You know, there's a whole lot of cancer that we know which is going on around. Or we most times we hear that, oh, that woman has cancer or that man has cancer and is going for chemo and all that. So, in children, there is childhood cancer. So, what is childhood cancer then, please?
So childhood cancer is just cancer in children. So when a child has cancer, that is childhood cancer. I like to explain cancer as growth of a body part that is uncontrolled. So the growth of any part of our body is supposed to be controlled. If your toe is growing, it has to grow in some uniformity and in relation to the other toes. You don't want your big toe, which to be bigger and shorter, to be longer than the other toes. The same way, you don't want your hand to be too big. So there are organs all over our body, in our abdomen, everywhere. And then cancer is just when a part of our bodies, those organs start to grow out of control. There are regulations. So you grow to a certain size, you grow to a certain shape, and then cancer is a distortion of those things. So that's just what childhood cancer is.
Oh, okay. It looks like we're getting a bit of feedback from one of us. Can you mute your mic for a minute? Let's see if that is going to help us in any way at all, please. Well, I guess he can't really hear us. So, Doc, I'm back to you again.
Yeah.
So, how common is childhood cancer, please?
Childhood cancer is common depending on how you describe common. We know that worldwide about 300,000 children will die of childhood cancer in a year. So that makes it quite common. And if you come to the wards, if you come to on admission, the wards where people stay longest, childhood cancer is one of the main causes of death among children who stay in hospital for a long period. So, I mean, really, it's not part of our top 10 causes of illness, we call that morbidity or death, but it is common because when you get it, it's you tend to stay in hospital for a long time, and sometimes, depending on when you present, the outcome may not be so good. Yeah, so it's quite common. We estimate that for our population, depending on the trend worldwide, we estimate that for our population in Ghana, we should have about 1,200 to 1,500 children developing cancer a year in Ghana. That's our estimate. Yeah, unfortunately, and that's one of the reasons we are talking about this, we don't see that number. We believe that they are out there, but we don't see them. They don't come to our attention. But childhood cancer is there.
Wow, this is something else. So basically this childhood cancer, is it like something that you can see physically on the outer part of the body, or is it mainly internal? How do you really detect that your child has a childhood cancer? I'm not too sure if you can hear me. Our network is playing up tonight. Did you hear me, Doc? Right, so we've got Jo Mens who is joining us tonight, and she says, "Hey, Diamondlady, hello, Jo Mens," and she also says hello to everyone.
Yes,
If you are
yes.
joining us tonight, oh, can you hear me now? Then,
Yes, so I just came back. Yeah. So we're talking about, I guess we're talking about what causes childhood cancer, are we?
yes,
Okay.
yes.
Yes, so some of them we have causes for, and some of them we have associations. Association means that usually when we see that you have a certain disease or a certain risk factor, then we see that childhood cancer also comes. So that is an association. So we know that some forms of childhood cancer are inherited. So that is, you get it from, like, it's when you are born with it, though it may not be picked up that early, but it's inherited. So we have genetic factors that accounts for some childhood cancer, or sometimes it's just a genetic predisposition, which means that your makeup makes you able to get a cancer. And then we have associations. We know that there are some diseases that are associated with childhood cancer, viruses, hepatitis, HIV, Epstein-Barr, they are associated with childhood cancer. We also know that radiation can cause childhood cancer. We know that there are some drugs and chemicals that as well can cause childhood cancer. Yeah, so by and large, those are the causes and then the associations of childhood cancer.
Oh, wow. So with this childhood cancer, does it happen when the child, like an infant, or within a certain age range at all?
So depending
Or
on the cancer that you're talking about, because when we say
yeah.
child, it's up to the age of 18. So depending on the cancer that you're talking about, there are some cancers that come much earlier. There are some cancers that the
Mhm.
baby is born with. There are some that come in the toddler ages of preschool, then school age, then teenage. So we see cancers throughout childhood. And depending on the kind of cancer you're talking about, the particular time that you are likely to pick it may vary. Yeah. So
Okay.
there are some abdominal cancers like kidney cancers. Those ones, a child could be born with them, or you pick them up quite early. But then there are some cancers like bone and brain cancers. Those we tend to see in older children. Yeah.
Oh, wow. So, does that means we definitely have so many types of cancer, isn't it?
Yes, we
What
do.
has Mhm.
We do. So, like I said, cancer is just a part of your body growing out of control. So, theoretically speaking, every part of your body can get a cancer. But the common cancers we see cancers of the eye. Some of them are commonly we see retinoblastoma. Those are cancers of the eye. Then we see cancers of our lymph nodes. So we have lymphomas. We see cancers of our blood, leukemia. Then we see cancers of
Okay.
our bone, osteosarcoma, muscle, rhabdomyosarcoma. In your liver, your kidney, we see cancers everywhere. So theoretically, a cancer can arise anywhere, your lungs, anywhere at all. Yes, but the commonest ones are the retinoblastoma, the leukemia, lymphoma, osteosarcoma, the brain tumors. Yeah, those are the common
Mhm.
ones.
So does cancer, can it be an external thing and an internal thing as well, isn't it?
Yes, so like I said, you can have a cancer of the blood, and that is a leukemia. So for a leukemia, you're not going to see a growth. The
Okay.
external one, as you put it, you are going to see a growth. So you may see a child with a jaw swelling. You may
Yes.
see a child with a jaw swelling, and then you can see a growth. But if it's a cancer in an internal organ, you may not see. So, for instance, you may have a cancer of the kidney, you may not see. But then
Mhm.
when it grows and goes to sit on other structures, or it grows so big, then the abdomen distends and then you can see. But if it's in your blood, you're not going to see it. Or if it is in your brain, you're not going to see it. Yeah, so we can have
Oh,
it external, you can look at it, and then we can have some internal.
okay. So why is it important for us to talk about childhood cancer then, Doc?
So it's very important for us to talk about it because it's not as rare as we think. Like I said, about 300,000 children will die of childhood cancer a year everywhere in the world. And in Ghana, we are expecting that we'll see about 1,500 children with cancer. But we don't. We see less than 150 a year. So where is the rest 1,300 and over?
Mm-hmm.
Where are they? Yes, we believe
Yes.
that they are there. And we believe that it's because we don't have the awareness. That is why these cancers do not come to our attention. And in cancer,
Okay.
when you come early, the outcome is likely to be better because what cancer does is that it spreads. So we have a
Yeah.
cancer in one part of your body, and what happens over time is that it spreads. You can have a
Mm-hmm.
cancer in a lymph node, and then it goes into your lungs. And when it goes into your lungs, we know that the lungs are for breathing. What happens? Then you have problems with your breathing. Or you can have a cancer somewhere, and then it spreads into your brain.
Mm-hmm.
So with cancer, if it is not detected early, or even if it is detected but it is not treated appropriately early, then what happens is that it spreads. And then when it
Yeah.
spreads, it's very difficult to take care of it. Let's
Mm-hmm.
imagine that there's a cancer in your bone that could have
Mm-hmm.
been removed surgically. That's an operation. But when this cancer has gone to your lungs, has gone to your kidney, has gone to your brain, then if you are going to have to do surgery, it means that you're going to take it out from all these places.
Yeah.
Unfortunately, sometimes when it spreads, then surgery is not an option because it spread all over. So that's why it's important for us to talk about childhood cancer, because it spreads. And when it spreads, then treatment is very, very difficult. Yeah.
Oh, wow. So, what are some of these signs and symptoms to look out for in children? It's quite difficult sometimes, especially with babies. They can't tell you what is happening to them, and those toddlers who can't talk, they can't obviously tell you I'm hurting there or I have pain there and all that. So, what are some of the symptoms and then the signs to look out for? And then, if you have to talk to a doctor, you go to talk to a doctor.
Yes. So, first of all, any persistent symptom, any symptom that persists that you don't have a good explanation for, that symptom should be pursued to what I call a logical end. So, your child has fever. That's just a high temperature. And then in Ghana, when anybody has a fever, the first thing we think about is malaria. So this child has been
Yeah.
treated for malaria over and over again, and it's still just it goes down a day and then the child is febrile. So that's a persistent symptom because it is not going
Yes.
away. So any persistent symptom could be cancer. So that symptom should be explored. So your child is losing weight. You've gone to hospital, they've talked to you about food, you are doing the food, everything. Your child is just losing weight, unexplained weight loss. Because some weight loss we can explain. Let's say your child has some other disease, then you know that that is why. But unexplained weight loss and it's just going on, that could be cancer. Night sweat, you find that the child is drenched in sweat in the night. Everybody is feeling cold and this child is just drenched in sweat. It's just sweating, sweating, sweating. That could be cancer. So that also should be explored. Yes. And then eye signs. So in childhood cancer, because retinoblastoma or cancer of the eye is very common, so eye signs like a squint. So a squint is like I'm looking at you but my eye is looking the other way. Yeah, so a
Yes.
squint, or the eye is bulging. The eye just
Okay.
comes out as it's coming out of the socket, or it's
Mm-hmm.
swollen, or there's a white patch on the black part of the eye. That could
Okay.
that could also be a cancer. So those eye signs should also be pursued or explored. Then children, when they start to walk, maybe when they are toddling, they have this day where they walk that's not so steady. But a child who has who was able to walk very steadily now begins to have a very unusual gait. He's walking as if he's wobbling, he's going to fall. So a change in gait could also be cancer. Persistent headache could be cancer. A child who used to write well in school, the handwriting has changed. That could be cancer as well. And so that should be explored. Now, swellings, lumps and bumps on your child. So your child, all of a sudden, the jaw is swollen, or we have lymph nodes all over our body, the neck, we have chains of lymph nodes in it. So you see that the neck is swollen. That could
Mm-hmm.
be cancer, or the limbs, that is the legs or the arms are swollen. That could be cancer. The abdomen is bulging. That's probably because there's something in the abdomen which is getting bigger and bigger and is protruding. So that could be cancer as well. And then bleeding. We know that children they live to fall, to run and hurt themselves. But when a child falls and then the child is bleeding, after a while that blood should stop. The body has a way of making the blood stop. Yes, provided it's
Mm-hmm.
not a very, very large gaping wound. But if your child just falls and has a bruise, that the bleeding should stop. But when your child bleeds and bleeds and bleeds and bleeds and it's not stopping, that could be cancer. The same way your child is
Oh.
brushing the teeth, and anytime your child is brushing the teeth, the gums are bleeding. That could be cancer as well. So that's also something to look for. Or your child just bruises easily. A little trauma a little, maybe the child is walking and bumps into a table, and that's, in your experience from your other children, should not make your child bruise, but you find that your child is bruising easily, that could be cancer as well. So like I said, any persistent symptom, if the symptom is persisting and you don't have a good explanation for it, that should be cancer, and you should take your child to a hospital. And so sometimes we give up so easily. Let's say you take your child to a health center and you are told that it's malaria, and you treat malaria and it's not resolving, and you treat something else and it's not resolving. Yes, you should pursue that symptom, because unfortunately one of the problems that we have is a lack of capacity, both in terms of diagnostics and human resource. We don't have a lot of doctors who are trained in diagnosing and treating childhood cancer, specialized places. So fine, but the expertise to pick up childhood cancer, suspect and refer appropriately, explanation for it. You should go and go and go until you get where you are satisfied. Yeah, for your child.
Yeah. Oh my word. Unbelievable. You've mentioned certain things that I never thought those things could be associated with cancer, with childhood cancer. Well, that is very, very informative information you're giving us today. So I'll just read a few comments and then we'll go ahead. So Sheila says hi. Hi, Sheila. Then we've got Dumithia, who is asking this question. What are the possible side effects of each treatment, both in the short term and long term? Well, we'll get back to that question after I have asked this question. What are the treatments for cancer then?
Yes, so we treat cancer with drugs, and treating cancer with drugs is called chemotherapy. So with radiation. So we said that radiation can cause cancer, but we can use that also to treat cancer. So that's like burning the cancer. And then we treat cancer with surgery. So in children, we are careful not to use radiation so much, but sometimes the need outweighs the side effects, and then we have to do that. So chemotherapy, surgery, and radiation, that's how we treat cancer. So that is the treatment of the cancer itself. But you know, when a child has cancer, a child is a growing person. The child needs to grow. So you still have to take care of the growth of the child. So there are other supporting things we do. We do nutritional rehabilitation. The child may need blood or blood products frequently. The child may need psychological support. The child may need to still be in some sort of school even when the treatment is going on, and so on. So the treatment is multidisciplinary. So it's not the pediatrician or the oncologist. We have the nurse, we have the nutritionist, we have the clinical psychologist working with the family. We have the teacher coming around to teach the child, even as the child is receiving chemo, the play therapist. They all come in to make it as bearable for the child and family as possible. Yeah.
Oh, okay. So with the treatment, does it depend on the extent of the cancer, or does the parent or the guardian have the chance to choose between wanting chemo or wanting radiation?
So whatever we do for the child, we bring in the parents. So
Yes.
we sit the parents down and we have counseling, so many sessions with them actually, because we want it to be a partnership. We will treat the child, but you will have to bring your child for us to treat. And then the more you understand, the easier the journey is for both of us, as in healthcare workers and then the family. So whatever we do, we bring the parents in, we counsel them and let them understand, and then they give their consent. They agree that we should go along this path. So sometimes the parents will have to choose depending on the extent of the cancer. So for instance, like we are saying that children should come early. Sometimes, unfortunately, the children do not come early and the cancer is so advanced. And then when it's so advanced, treatment is so difficult that you have to explain to the parents and explain what to expect, explain what you believe will be your success rate, and then you have them choose how aggressively they want you to go, or how and non-aggressively they want you to go. But cancer treatment always will involve the parents, will involve the family, because it's a decision. It's not as simple as, say, treating a pneumonia or a malaria. Sometimes it can be up to even 3 years. So because it can take a long time, and sometimes they have to live in hospital for even a month and then go back and come a bit. Yes, so we always involve the parents. We have the parents work with us. We explain to them what we want to do. They have the choice to say that, oh, they prefer this one or that one. Yes, but really sometimes your hands are tied because they've come in so late. So then you just have to explain to them that, oh, this one is so late that maybe if we add on other drugs, it may be so difficult for the child to tolerate it, and so on and so forth. Yeah, so the parents do have a say, definitely. Yeah, the parents have a say.
Oh, okay. So I guess there might be some challenges as well, isn't it, with treating childhood cancer? So what are some of these challenges? Are there any?
There are definitely challenges. There are definitely challenges. The first challenge is late presentation or late coming to hospital. And that is why this is so important for us to do. Because when you see a child that you think that if this child had come a month earlier, and you have a history of, okay, this has been happening for 7 months, for 8 months, for 5 months, and you feel that if this child had come just a month earlier, you would have done so well for the child. The child would have recovered. It's so heartbreaking. It's you don't want to do it, but unfortunately we are forced to do it. So the first challenge we have is late presentation, and the late presentation is sometimes because of funding. So
Yeah.
sometimes it's because we don't know, and sometimes it's because of funding. Unfortunately, cancer treatment is not covered under the National Health Insurance Scheme. I say that because I'm speaking from Ghana. I mean, for in Ghana we have the National Health Insurance Scheme. Yes, unfortunately, cancer treatment is not covered on it, and so it makes it very, very difficult. And so, because of funds, some people may not come early. But let me just use this chance to say that if you are listening from Ghana, don't let funds be the reason why your child that you suspect has cancer does not come to hospital. You come. You come. Come because even though we don't have the money from a health insurance scheme and all those things, we get philanthropists who walk in and day out. Well, maybe not day in and day out, but people do come. And so once you come, even if you don't have money, we can do something for you. So come. So aside funding, another challenge is that the we don't have a lot of doctors who are trained in cancer detection and cancer management. So that's
Okay.
also another challenge. Yes. So that one is a policy issue. You know, our government should
A bit of freezing issue tonight. It looks like the network is having a bit of troubles. Let's see if we can get Lion Oscar.
Hello.
look into this.
Seriam, are you back? It looks like the
Yeah, that's right.
network is playing up tonight. Can you hear me?
I'm back.
Yes, I can hear you.
I can hear you. I don't know if you can hear me.
Right. Just a minute, Oscar. I'll take you off again and then we'll finish up with Seriam.
That's okay.
Right, Seriam, you're back. Sorry. The network is playing up tonight. Can you hear me?
About the human capacity. Like I was saying, it's for the government to be more interested in childhood cancer. I don't know if I'm on actually. I don't know if I'm on. I'm just talking.
You are on. I can hear you.
Am I on?
Yes. Yes, you are on. We seem to be having a bit of technical issues tonight. I'm not sure. Can you hear me, Serial? Okay. Can you hear me, Serial? All right, Lion Oscar, maybe I'll just hold come to you now.
Okay.
Can you turn your volume down a little bit because we are echoing again?
Okay. Is it better?
I'm still echoing.
Wow. Is it better now?
It sounds a lot better.
Okay, good to know.
Can you tell us a bit more about Lions are doing? So now, are you here to invite people to join Lions Club?
No, why we are here is to create awareness. Of course, we would like for people to come to join us to volunteer service in providing service to the needy in our various communities. But the main motive for our coming or for us undertaking this activity is to create the awareness of the fact that childhood cancer is curable. And so parents and guardians should look out at their parents should to try to identify any forms of lumps or anything that looks abnormal on their body. And when they observe that, as doctor indicated, they present it to the health facility as early as possible. So to answer your question in a more brief manner, we are here to create awareness on childhood cancer and not to look for members to join us. But of course, we will be glad to have new people joining us.
Okay. We're just saying that if anyone would like to join the Lions Club, where would they find the Lions Club? Their website or anything?
Okay, good. There are a good number of Lions clubs here in Ghana. And what they can do if they want to find a Lions clubs to belong to here in Ghana is to go to the Lions Clubs International website. When they go to the Lions Clubs International website, they search for Lions Clubs in Ghana. It will bring out a portal of all the Lions Clubs here in Ghana. Yes. Currently, we are a little over 30 Lions Clubs here in Ghana. And so when you look at them, it shows the community or the area in which each of the Lions Clubs meet. So, for example, Accra Ebony Lions Clubs meet at Erata Hotel in East Legon. Accra Harmony Lions Clubs meet at Adenta. And so it comes, the various places of meetings is attached to each of the Lions Clubs we have here in Ghana. For example, Accra Golden Lions Clubs meets at the around Ridge. Yes, precisely Coconut Grove Hotel. Yes. And so, yes, exactly. So you just need to go to the Lions Clubs International website, look out for Lions Clubs in Ghana, and then you find the various clubs with their places of meeting.
Okay. So just one last question. It might not be the last question, though.
Sure.
So with this way of raising awareness through this network, the other way that you raise awareness is it by gathering your group and then getting on the truck and going around with banners to raise the awareness?
Precisely so. In fact, our last activity on childhood cancer was along the streets of Pantan and Oyarifa communities. Yes, the people in Ghana will be familiar with that. So what we did was to go into the community to engage the community members. We had placards on which we had relevant childhood cancer information displayed on it. We also had leaflets which we shared to the community members. And so we had a one-on-one engagement with members. We are choosing the online medium this time around because of COVID and all these restrictions. Yes. Of course, the online also gives us the opportunity to reach a much bigger audience at a particular point in time. But as you said, we also have face-to-face engagement. The previous one, before the last one I spoke about, was done in one of the churches, in fact, a good number of the churches here in Accra. So Lions Clubs were in a number of churches. They had time, and then we educated members of the congregation on childhood cancer, like it's been done here. Yes.
Oh, okay. That is a good thing. So, do people come out of their own way to support you, as in monetary side, or how does your sponsorship go?
Yes, to a large extent, it's from the contributions of members. Yes, and as you may have known, the Lions Clubs International, we volunteer service. We in this ways time, talent, and resources. And so we volunteer, of course, our time, our talent, and resources. So to a large extent, the funding of most of these activities are undertaken by individual members. However, we are encouraged to go out there to seek for sponsorship where we require one to help us to make a much bigger impact. Yeah. So one of the activities we undertook in a couple of months ago was in collaboration with one of these pharmaceutical companies to test people on diabetes, for example. Yes. So one, we didn't have the human resource to do that. We also didn't have all the logistics involved. So we got into a partnership with one of these pharmaceutical companies here in Ghana to undertake that. Yes. So we do undertake partnership with the private sector. We do solicit for funds to undertake activities, but to a large extent, it's through the contributions of individual members.
Oh, okay. So, in case, let's say, a family finds out that their child has cancer and they don't have money to pay for medication, chemo, and all that, is Lion Club able to raise money on behalf of this family at all?
Yes, to some extent, I can say yes. We can help. Even if we cannot help directly or by raising funds from our individual members, we could speak with foundations and other institutions or philanthropies that could come to help such a family. So all we need is to be informed, and then we will let them know which way we could help. But it helps that they don't stay at home, but then speak to people or groups like the Lions Clubs International to offer assistance. Yes, we may not be able to foot all the bill, but to a large extent, we should be able to help to some extent. Yes.
Okay, that sounds nice. I am going to bring Dr. Serum back. Looks like both of us are echoing again, so I'll be helping you a minute.
Okay.
Hi, Doc. Welcome back.
Hi. I took a short break.
Yes, I noticed that. I think our network is just playing up a little bit. Yes, Joe said, yeah, very informative. And then he says, I'm echoing back. Yes, I hope it's much better now. Whenever I go to Lion Oscar, I am definitely echoing back. When I come to you, it's okay. So, are you going to continue from what you were saying? We got distracted, isn't it?
Yes. I was talking about the challenges, and then I was actually saying some of the ways we could address the challenges as well. Yeah. So we also have these beliefs, our cultural beliefs that work against us a lot of times. Yes. So you find that when there is a swelling or a lump, a lot of people in Ghana will say to you, it's not hospital sickness. Sometimes they are afraid that when you go to hospital, you are going to have surgery. So they say that a swelling must not be cut. So they don't want to come to hospital. Sometimes, unfortunately, our elders and spiritual leaders, our spiritual leaders don't help us. Yes, there are some of them that actually bring their children to hospital. They will tell you that this child was brought for prayers, but I thought that as I pray, you should also do your bit. But there are some who won't bring, and so sometimes those things also work against us. And then, like we said, if you come early, then the outcome is better. But a lot of times too, we get a very bad rap because there are children who come in late. And when they come in late, then you have to sit down and explain to the parents or the family that it's so late, the cancer is so advanced, it's spread everywhere, there isn't much you can do. And then it seems like cancer cannot be cured. But cancer can be cured. It's just we don't see it early. When we see it early, about 70% of childhood cancer can be totally cured when we see it early. It's just we don't see it early. And the thing about children is that, because they are children, when you cure them of the cancer, they have so many more years, 50, 60 more years of productive life to live because you have cured them of the cancer. But then when you don't get them or you get them too late, then there isn't much you can do because the outcome is going to be bad. Yes. So sometimes the bad rap we get that when a child is brought with cancer, then we say that this one we can't do much about it. But it's because the child has come late. Yes. So those are some of the challenges that we have. But with education, we're just saying that when it comes to cancer, we have this phrase that sounds so cliche, but it is true. Time is life. When it comes to cancer, time is life. Because when you come early, then we can do a lot for you. And when you cure a child of cancer, that child has a whole lifetime to do whatever the child wants to do. But unfortunately, if you can't cure the child because the child has come late, then that's a problem. The other thing that we want to say that people should think about is that we in underdeveloped countries, especially sub-Saharan Africa, we have the highest burden of childhood cancer. Of all the childhood cancers in the world, we have about 80% of the burden of childhood cancer. Yes, because we say that some are related to viruses and all those infections and so on and so forth. So we carry the highest burden. But unfortunately, of this large burden that we have, only about 20 to 30% will be diagnosed and appropriately treated. We only have 2 centers in Ghana where comprehensive cancer treatment is done for children. Only 2. So as a people or as a government, we should be saying that there should be comprehensive cancer treatment centers in every region. Because sometimes when you see where the people are coming from, just transport to come is a problem. So if we have comprehensive cancer treatment centers in every region, and we have trained people to manage the cancers in those regions, and we have the support system, we have the diagnostics, that is like when you want an MRI or a CT scan, it is easily available, it's affordable, those things, then we are moving forward. So we are diagnosing so few cancers, and we wish that we diagnose more, and then when we diagnose, we have the resources to be able to care for these children, because they're just children. We cure them and then they grow, they do everything, they become teachers and doctors and farmers and business people. I mean, they do anything that they want to do.
Yeah. Wow. I just wish parents will start noting all these and sending their children to the professionals to do their job. I guess the Lion Club is doing so much and they need to be applauded. Honestly, I think people should start volunteering their own time and to join the Lions Club and to support them to help get rid of childhood cancer, because it's such a shame. Sometimes you watch TV, and then even if you read online and you watch on the news, the way children are suffering from childhood cancer, you could see it's very, very painful. Every disease or every sickness is painful, but it looks like cancer is of a worse pain than any other pain. So if you're a mom or a dad or a guardian listening to us, please take note of all the things that the doctor has mentioned today. Please start checking your child for all the symptoms and the signs. Take your child to the hospital on time. Let these doctors do their best. If they detect that the child has a cancer, they could help save a life than you losing your child's life or something else, or maybe it might be too late. I will just read one comment from here. So Joman says the government should be challenged on this issue. What do you think then, Doc? I think the government should be challenged on this issue.
Definitely. I mean, you always need, no matter what the professionals, the parents, anybody, the churches, Lions Club does, you always need the government to create I'm breaking again. Yeah, so no matter what individuals or organizations do, you need the government. You need childhood cancer to be on the agenda. Sometimes when you look at it, you feel that children are really just an afterthought. Why do I say so? Because there are some cancers that are on the National Health Insurance Scheme, for instance, but childhood cancers are not. And you get a feeling that because it is adults that sit at the table and make the policies, they remember themselves. But children are like an afterthought. It's like when we finish eating and something
Yes.
is left, then we give it to the child. Yes, it's I'm saying it and I'm laughing, but when you find yourself in
They
with
are
a
the
child who,
future.
yes, I mean it's so heartbreaking. So yes, the government should be challenged. There's no reason why somebody should come from Elubo to Accra for cancer treatment. There's no reason why somebody should come from up north OT region to Accra for cancer treatment. No, the government
That
should
is
really be
bad.
challenged. We should look at our NHIS. We should look at having our drugs on the cancer drugs for children on NHIS. We should look at having hospitals that are equipped to deal with childhood cancer, and we should look at training of doctors in oncology or cancer care so that they can take care of the children. Yeah.
Of course, because that is not a sickness that is going away tomorrow or the day after. It
No,
looks like
no.
it's here to stay with us, isn't it? So let's go back to Dumifie's question, where he says, "What are the possible side effects of each treatment, both in short and long term? Are there any
So
side effects at all?" Yeah.
there are definitely side effects. All medications have side effects. Every medication has a side effect. But when you want to choose to give that medication to anybody, and especially children, you look at the benefits and then you look at the risks. What you need
Yes.
to do is that when you give any medication to a child, first do no harm. So the benefit must outweigh the risk of
Yes.
giving that medication to a child. Yes, so every medication has side effects. Just like every medication, cancer drugs have side effects. And cancer drugs are designed to be strong drugs because of what cancer is. So, because they are strong drugs, their side effects tend to be pronounced. But we are able to manage these side effects. That is why the support systems, when you're treating cancer, is not just about treating the cancer, but the support systems matter. For instance, when you give a drug to a child and it makes the child anemic, you must know that that child may need a blood transfusion. So, as a support system, you should have blood facilities available. When a child needs a transfusion, you give it to the child.
Yes.
Cancer treatment can sometimes cause hair loss. And so, what can you do about it? Well, a child may not mind, or they may have to wear wigs or they wear caps to take care of that. Cancer treatment can give maybe sores in the mouth, and then you have to manage the pain. You have to give something for the sores in the mouth. So there are side effects of chemotherapy. There are side effects of surgery. Any surgery has side effects. When you do a surgery, the patient is going to bleed, the wound may get infected. But again, you ask yourself, why do I want to operate on this child? Is the benefit going to outweigh the risk? If you are going to save a life, and if you have ways of managing the side effects, then you go ahead. We talk about radiation. We don't use it often, but we do. Again, it has side effects. So a lot of measures are taken to make sure that you direct the radiation to where exactly you want it to go to. If you are going to a particular side of the body, the radiation goes only there. And then the doses are such that you do not have a lot of side effects. So there are side effects, but it is about minimizing the side effects as much as possible, and then treating the side effects when they occur, and making sure that those side effects, the side effect that you are causing, do not outweigh what you are trying to treat.
Okay. All right. Well, this is something else, We just wish nobody gets this cancer on earth. Well, Dumefia has another question, and then the question is, could this treatment affect my child's ability to become pregnant or have children? If so, should my family talk with a fertility specialist before cancer treatment begins? This is a big question.
Yes, it's a big question. So there are some of the cancer drugs that could affect fertility. So we try to avoid those ones in children. We don't use them. And then even when you talk about affecting fertility, it depends on the dose as well. So you either don't use it at all, or you use it at a dose that you are comfortable with, that has minimal to no side effect. Yes. So for children, we don't really use drugs that will affect fertility that much, and even when we do, we use them at doses that do not affect fertility. But we always talk with the parents. If we know that we are going to give you a drug that may affect fertility, even in the lowest doses, we have that discussion with the parents. By all means, we give them the options, yes, but as much as possible, because they're children, we try to avoid those drugs.
Oh, okay. I never knew about that. So Maggie says, hello, ladies. Hi, Maggie. Then we've got Papa Mobutu, who says, good show, Diamondlady. Oh, thank you. From Lion Alex. Okay, the club president, Accra Ebony Lions. Oh, hi. Thank you, Alex, for joining us tonight. So it looks like we've said a lot tonight. I am going to bring Lion Oscar on for him to give us his last message, and then we will get the final message from you, Dr. Seriam. So if you bear with me, let's see. Hope it doesn't echo again. Oh, it's echoing.
Hello.
Hi, Lion Oscar.
Yes.
Can you give us your final words, or if there is any information you want to give us out there?
So what I would like to say is that whether you choose to join a Lions Club or not, please spread the information that childhood cancer is curable. Early detection is key. If you are considering joining a Lions Club, I'd want to say that it's a good thing to be a lion. In Lions Clubs, we serve. And just to end, let me remind listeners that and viewers that of our five global courses, Lions Clubs International, as we are doing here, does not only undertake activities on childhood cancer, but we also do same on diabetes, vision, hunger, and the environment. These are our 5 core global courses. More than that, we do a lot more. It's a great thing to be a lion, and I encourage you, our listener and viewers, to take interest in joining a Lions Club. You could also choose to volunteer. So look out for our activities and be a part of it. But more importantly, please spread the word that childhood cancer is curable. Our children are our future. Thank you, Diamondlady.
Thank you so much, Lion Oscar. It was a pleasure to have you on the program tonight. We hope we get you back here at some point, maybe to talk about the vision or the diabetes or any other thing that you do.
Exactly.
And we hope our listeners will come and join and volunteer, because volunteering is very, very necessary. So I'll just let you go. We'll say goodbye to you, and then we'll give Dr. Seriam to give us the final words. Okay?
Good. Thank you.
Lion Oscar. Bye to you.
Bye-bye.
Hi, dog. Sorry. It looks like there was the echoing back and forth again. I will just say hello to I am Baby V. She says hello from Lion Vera, Accra Ebony. Hello, Vera. Lion Vera. Thanks for joining us as well. So, what are your final words for us, Dr. Seriam? I might not have asked you so many other questions, but then if you've got any final words, and if our viewers, if you've got any questions, this is the time. We've got just 2 minutes to go. So what are your final words for us, please, Doc?
We've said it over and over again that when it comes to cancer, time is life. Yes, so the people who are opinion leaders in society, they have to work with us. When you find someone in your community or your church or your wherever, you know, a parent, and you think that this parent's child may have a cancer, or your own child you think may have a cancer, I urge that any symptom that you have not got a good explanation for, you follow that symptom until you are satisfied. Because when it comes to cancer, time is life. Cancer spreads. Cancer starts from maybe your eye and it goes into your brain, and then there isn't a lot that can be done for you. Or it starts from your leg and then it goes all over your body, and then there isn't a lot that can be done for you. Yes. And again, the advocacy. I mean, children are our future. When a child is cured of cancer, it's like it's as if the child is now beginning their life because they've got so much life ahead of them. Yes, so our cancer treatment centers, our cancer drugs, they don't need to come from the child's parents' pocket because it's so expensive. I mean, you can treat a cancer with, say, 2,500 Ghana cedis, but you can also treat a cancer with 35,000 Ghana cedis. It's so expensive. To the average family, that's a lot of cost. So the government should, I hope somebody is listening to me or somebody
I
who
hope
can,
so too.
somebody
Yeah.
is listening to me. Yes. So these are things that we should discuss. When we sit at the table and we are sharing, let's remember the children. They are not at the table, but they are there. Let's remember them so that when we are sharing, it gets to them. Yes. But most importantly, early detection or time is life. So if you think that your child or someone you know may have a cancer, please let that child come to hospital, get referred appropriately, and come to us so that we can help the child. Yeah.
Oh, thank you so much, Dr. Serian, for joining us tonight. And I would like to say thank you to Lion Oscar as well for coming to raise their awareness about childhood cancer. We've got so much information that was shared with us tonight. If you watched us tonight, either on Instagram, on YouTube, or on Facebook, please share this to your own page or to other groups. Let them also get this information. It's very, very necessary. We need to pass this information on. Just don't watch the children suffer. If you know of a child or if your own child is having these signs and symptoms, please, now is the time. As just the doctor said, time waits for no man. You know, when it comes to cancer, it is really, really a matter of life and death situation. The earlier you take the child to the hospital or to the professional for them to have a look and then decide what can be done for the child, the earlier the better. Please, let's try and share the information. Let's try and share the love out there. So we say thank you again to Dr. Seriam. And if you're looking for her group or her page on Facebook is Baby Child and Co. They also have a website. Go and have a look at it. It's Baby Child and Co. As soon as you type that in, that is the only Baby Child and Co. is going to come up. Go on there, just explore the
Yeah.
information on there. You can ask them questions, you can get in touch, and then there's a whole lot to learn on their page. I have been on there and I was so amazed with the things I saw on there. She also has a YouTube channel, which is Baby Child and Co. Go and listen to it. Her videos are so short and precise. You are going to get so much information about certain things you didn't know. It's not just about childhood cancer, it's about breastfeeding, a whole lot. Just go and get this information and pass the information on to others. And please, if you can volunteer with the Lions Club, then please go and find Lions Club online and join us well, especially if you are in Ghana. Join Lions Club. And if I was living in Ghana, honestly, I would have joined it. Anytime I get the chance to go to Ghana, I think I am going to join because I love to volunteer and help others all around the place. And if you can, please try your best. It's very, very necessary. Thank you to all our listeners and thank you to all those who supported us tonight. And Jome says, thank you, Doc. And she says, always on point. Oh, thank you so much. Have a good evening. All. See you again. Tomorrow, don't miss out. It's definitely something about love. Come and watch us on Diamondlady Show. See you soon.